Alongside an individual focus on self-care, pre and post any shift of work, we wanted to offer a process for diffusing actions with any group of nurses who are working together for a shift of work, in any setting, which is led by an individual who we have badged as nurse in charge, but in reality, this activity could be led by any member of a nursing or MD team. Well, it helps communication and understanding by encouraging honest and open reflection on thoughts, emotional states, and responses to experiences that have recently taken place. It acknowledges what has happened and supports discussion to help understand it. It also helps the celebration of success and growth in service users and the staff team. It maximises the functionality of individuals and the team. It offers a supportive environment, a shared holding of things that are difficult to manage. The diffusing process, what is it? It's a coming together of the team pre-shift, physically if possible, or remotely via Skype or phone, etc. to plan for that particular shift, encouraging all to have open and honest communication with each other. And then an agreed time mid-shift when the team reconnect in order to check that the original work allocations are workable and to re-evaluate this if necessary. And then finally a coming together of the team post-shift, physically if possible again or remotely via Skype, phone, etc. to review the shift, encouraging all to have open and honest communication with each other in order to support the mindful process of leaving the work of the day or night where it belongs. What if it's been a particularly busy or difficult day? It'll be helpful to acknowledge that it has been a particularly busy and/or difficult shift, to emphasise areas of good practice and how well everyone's done. Thank them for their efforts during the shift. To ask how everyone has been feeling during the shift and how they're feeling now. If any strong feelings or opinions are expressed, just let this happen. Don't feel you have to rationalise these or come up with the answer. The simple message should be, it's okay to have feelings and it's okay to express them. You can reassure staff about the normality of any reactions, thoughts or feelings they may experience. Normal reactions of normal people to extreme and busy circumstances. If any physical interventions were used during the shifts, check the physical well-being of staff. Ask them if they have any important points or observations they want to make about anything that's happened during the shift, or any problems like racial abuse, threats, procedure or equipment issues. Don't try and sort these out now. Comment or explain if you can, but make it brief. When necessary, encourage staff to take any issues to the weekly staff meeting, clinical supervision. Try and give staff a sense of proportion, perspective and control over what's been happening during the shift. Be aware that some staff may want to ventilate feelings, while others will prefer not to talk about what's happened. Encourage them to use existing supervision arrangements and staff meetings as a means of getting support and also a way of supporting each other. Finally, emphasise areas of good practice again and how well everyone's done. Thank them for their efforts during the shift. Having outlined the purpose of diffusing and suggested a process, we thought it would be useful to give an example of how this could actually be used within an ordinary working day. Hi everybody, good to have you here today. Having been made aware of all our service user needs from the outgoing team, alongside their reflections, I just wanted to take a brief period of time to encourage you to take stock of where you personally are at this moment in time. I want you to consider your needs for this shift of work, and for us as a team to agree how we're going to look after each other so that we can provide the best possible care to our service users and feel satisfied with our achievements when we complete this span of time at work. In a moment, I'll encourage you to check in with yourselves and with each other. But first, let's agree that midway through the shift, let's say 10 a.m, that each of you will take a brief time to check in with me, remotely or face-to-face, whatever's possible. The purpose of this is to enable me to receive feedback from you on how you're doing and how your original work allocation is panning out, to understand any difficulties that you're having in terms of delivery or anything that's causing you difficulty or distress. I don't want you to go the whole shift before we as a team have the opportunity to rejig allocations or workloads as needed in order to support each other. I appreciate it's sometimes really difficult to be honest with me and open about things that we struggle with. Let me reassure you that today's team is incomplete without you. We can all be flexible and adjust to each other's varying experiences of what life is throwing at us at the moment. It's hugely mature and professional to accept support in this way. It is important to be as compassionate towards ourselves as we are to others, accepting care and assistance to perform at our best. I'll also check in with you all briefly at the end of our shift of work to review our time together, either remotely or face-to-face, and celebrate our achievements. Please remember, you are not alone during this shift of duty. You're part of a team, however distant we are or feel from each other location-wise. You are a very valuable part of the care delivery we are collectively involved in. Let's briefly focus on ourselves as we prepare to meet the needs of others. Let's do the 3-step breathing practice together. Just be still and become aware of your body sensations, your physical experiences, your feelings and thoughts. Focusing on these, acknowledging where things are for you right now. Draw this awareness together and focus on your breath, its entry and exit points, the rise and fall of your chest. Expand this attention out now to include the whole of your body and beyond, to others in this place. Okay team, let's move on and out into our day's experience and work, keeping close touch with each other. What about an example following a particularly busy or difficult shift? Hi everybody, thanks for taking the time to be here. I wanted to start by acknowledging the busyness and difficult nature of this shift of work, and to say how proud I am of the standard of care that you've all delivered today. I know this hasn't been easy with everything you've had to manage and juggle. How are you all right now? What sort of emotions have been around during the shift for you? I know that I've felt a wide range, from frustration and irritation at the limited time I've had to meet the needs of patients. I've also had some concern and discomfort with some of the patients' behaviour when they've been in distress. How about yourselves? What have been your experiences? It's okay to feel these things and to express how you feel without judgment. Here it's a safe place. It's very normal to have these responses. You've been dealing with incredibly pressured and extreme circumstances today. It's important for us to release these feelings here, where they belong, and not take them into our home life with us. Those of you that have had to physically intervene today to prevent problems, and those of you who have been on the receiving end of any focused verbal salvos, I just wanted to check in with you about those things. Has anything happened that we as a team are not aware of? Have any threats been made? Difficult interactions? Or have there been any problems with procedures or equipment that we need to address together? If some of these things are difficult to talk about here, please catch me afterwards, or use your own clinical supervision to chew these things over. Don't hold on to them on your own. Let somebody help you with them. It's been a difficult time today. Fortunately, it's not like this every work shift, but it has no less impact because of that. You've all done a really good job managing difficult people and situations. Well done. I've been proud to be part of this team today. This is why we all come into nursing. Allow yourselves to focus on the positives of your hard work today. Take care and safe journey home.